Today is February 26th. My name is Ethan Baldwin. I'm a health policy analyst. And we'll go ahead and begin with introductions. So we could just start with non-division staff and go from there. Would anyone like to introduce themselves on the phone?
Hi, good morning. My name is Scott White. I'm the Director of Regulatory Affairs for Moda Health. Pleasure to be here. Thank you.
Thank you, Scott.
Hello, my name is Merlene Converse, and I am a government relations consultant with Kaiser Permanente. Thank you for inviting me.
Good morning, this is Melanie.
Good morning.
Anderson. Sorry, Antoinette.
Go ahead, Melanie.
Okay, hi, I am the regulatory attorney for the Pacific Northwest for United.
Good morning. This is Antoinette Iwachi, and I'm the Senior Public and Regulatory Affairs Specialist for Cambia Health Solutions, also known as Regents, Blue Cross Blue Shield of Oregon.
And I'm Heather Weaver. I'm an individual product manager with Regents, and just here to support Antoinette as needed.
Hi, I'm Bo Wrights, a government affairs policy analyst with Providence Health Plan.
And this is Chris Bonneff. I'm executive director of NAMI Oregon, the state chapter of the National Alliance of Mental Illness.
All right. Anyone else? It looks like Katie, I see you on.
Good morning, everybody. I'm Katie Button. I use she, her pronouns. I'm the plan management analyst for the Oregon Health Insurance Marketplace. So I certify the plans we sell in the marketplace, and I also design the cost sharing reduction variants of the standard silver and the standard gold plan. Thank you.
Thank you. Anyone else that hasn't gone yet? All right, we'll go with division staff next.
Good morning. This is, go ahead, Tim.
Okay. Hi. Yeah. Hi. This is Tim Hinkle. I'm the actuary at the division.
And I am Karen Winkle, the rules coordinator for the division. And I am recording this meeting. Thanks.
Perfect. So thank you, everyone. As you're at this meeting, I'm sure you already know what it's about, but just to give a brief recap, each year we are required by law to update the standard plans or to take a look at the standard plans and make sure that they comply with HHS actuarial values. And this year, the bronze was in compliance, so we won't have to make any changes there. The silver was not, so we'll discuss that. And then we also are required by law to update the list of prosthetic and orthotic devices in rule that are covered by ORS 743A.145. So that's also what we're doing here. After that, we'll accept any public comment and discuss next steps. Before we proceed, I do want to address the elephant in the room that we know there is a bill out there that would likely expand the coverage of prosthetic and orthotic devices. It's still pretty early in session, so we're moving forward with this rule as it stands now and kind of discussing contingency plans should that bill keep moving forward. So we'll keep everyone updated on that. But as of right now, we're just kind of going forward with what we know. So I hope that addresses what will likely be an issue for some people to raise, but I think we'll deal with that if it comes to it. So with that in mind, we'll go ahead and jump into the exhibit that shows the standard silver plans. So as I mentioned before, each year DCBS by rule creates exhibits for the standard bronze and standard silver plans. These are consistent plans that must be offered, so it can do a true apples to apples comparison for consumers. Each year, the federal government releases an actuarial value calculator that adjusts benefits and the such that our actuarial staff, mostly Tim, plays around with and sees if our existing plans are in compliance or if they're not. In this case, the standard bronze, as I mentioned, was already in compliance, so we don't need to make any changes to that. But the standard silver was a bit high, so we do need to reduce a benefit here or there to get us into compliance. So as you can see, we've listed 3 options, kind of the 3 most palatable. None of them are great. It's never fun to reduce benefits, but it's just kind of the situation we're in. So I'll open the floor to discussion, or I guess I can highlight the first option raises the combined medical and drug out of pocket. The second option raises just the medical and then also raises the specialist visit copay. And then the third option does the combined medical and drug and the primary care copays. So does anyone have any thoughts on, preferential? And I also understand that in most cases, people want to take some time to noodle over this. Nothing here is a commitment. We'll leave it open for about a week and you guys can all give feedback and we'll kind of go from there and present the information to our leadership and move forward from there. But just while we have everyone on the phone, does anyone have any thoughts about the options as we see them? Yes, Katie.
I would prefer us to go with the second option and not increase the maximum out of pocket higher than the bronze plan. I know that when I was working on the cost sharing reductions on the gold plan, the bulk of what can get you some AV room is adjusting the specialty charge. So I think that option that allows us to increase that specialty charge a little bit, but continue to maintain that maximum amount of pocket that's not higher than the bronze plans is useful for consumers as they're comparing plans. It's hard to explain to consumers why the bronze plan has a lower MOOP than the silver plan.
Okay, good feedback. Merlene, I see your hands up.
Hi, we had a different perspective, although Katie, you bring up an excellent point about the maximum out of pockets between the two. We were preferring option 1 because it left the day-to-day benefits unaltered. And we thought that would be easier for consumers to understand that their deductibles and their co-payments weren't changing. But Katie, you do bring up a good point and we'll do some more thinking about that.
Yeah, it is difficult. You're both highlighting the issue that, pulling on one lever can be easier for some people. Pulling on another is better for some people. There's no right or wrong answers here, unfortunately. Anyone else have some feedback or some thoughts? Again, nothing here is a commitment. We can just kind of throw things against the wall and see what sticks.
I would just also say that currently I have the 73% plan with a $90 specialist visit. And so I'd have to see, I try not to have the cost sharing on that plan be higher than the base silver for obvious reasons. So I'd have to see if I can lower that office visit to go back down to 80 and see if I have enough room in the deductible to get it to meet AV and match that number 1 plan. So if I cannot, I will submit that as comment via email.
Perfect. And yeah, just to reiterate, we'll probably give it about a week for everyone to take it back to their teams and discuss and then submit further comments. And then I'll present all of that to leadership and then I'll share with the group kind of which direction we think to go. based on the feedback we've gotten from you all. But yeah, anyone else have any other thoughts? Or is everyone kind of reserving feedback until they've had a chance to discuss with their teams?
Yes, I am. This is
Yeah.
Antoinette from Cambia Health. Thank you.
Yep, no problem. I mean, that's why we do this. You know, sometimes this meeting is just to kind of get this in front of everyone so that they can talk it over. All right, well, if no one has any further feedback on that, we can go to the next topic on the agenda, which would be the prosthetic and orthotic discussion. Now, this rule is a little bit unique. The underlying statute requires us to update the rule yearly, even if there's not really any tangible changes to the list of devices. So what we came up with last year is that we would just place this as of January 1st of the coming year. And then that way we would be able to at least meet the statutory requirement of updating the rule. And, you know, we can always go further if there's other things, but based on our internal discussions, it didn't look like there needed to be much change other than that. But I welcome any feedback there as well. And again, we'll leave this open for you know, feedback after people have talked to their teams. And just to kind of repeat myself, we do know that there is another bill out there that could kind of you know, blow this up a little bit. Oh, Antoinette, yes.
Yeah, hi, Ethan. So I just wanted to make sure, and I'm looking at subsection 2 right now, that before I go to my SME subject matter expert on this, that you guys have also reviewed the CMS L code and the HECPICS to just make sure that there weren't any changes there.
Yes, I reviewed it with our internal team and they didn't see anything. So
Okay.
That doesn't mean we're, you know, perfect. If you catch something and it needs to be changed, we can always go from there. But yeah, I think this is still good.
Great. Perfect. Thank you so much.
All right. Anyone else? All right. Well, it's a chatty group today. So I guess we'll just open it up for any public comments, although I don't see anyone that was not already included. Antoinette, yes.
Yeah, I have a quick question. So before we open up to public comments, or maybe after public comments, you're probably going to do this anyways. Would you kind of give us the timeline leading to final adoption so that at least for us, we know what to include in the benefit booklets when we file on the required or by the required timeline that the DFR gives us?
Yeah, definitely. We can chat about that after we go. That'll be part of next steps.
Okay, perfect. Thank you. Sorry, I knew I jumped ahead.
No, you're fine. I mean, honestly, you know, we don't need to be hung up on formality. All right. Well, I don't hear anyone from the public comment, so let me see if I can find my timeline here. Bear with me for a second. So what I will say is typically with this rulemaking, based on when we get the AB calculator from the feds and when we're able to play around with it and pull together the group and do all of the fun stuff that we have to do, we typically won't have the final rule in place before rate filings are due. You know, it'll still be quote unquote a draft, but that'll basically be the benefits that should be covered going forward. But based on our timeline, I would think that we should have have a pretty good idea of what the benefits should be by no later than the end of March, assuming that there isn't anything that gets blown up. If you need it earlier, I can try and push it through, but I would think that we can get some information back to you by mid to late March. Does that sound doable?
I think so. I don't think we have any issues, at least for the forms. If we have, and I'm talking about the policy forms.
Yes.
If we do know or have an indication of what they may end up, or the DFR may end up adopting, at least, I can advise our policy form folks to file with brackets, variable brackets, maybe with the existing cost share, knowing that we have the ability to change it once the rules are adopted. And also I'll let our rates and forms, our rates folks know, I guess, to factor that in when they do the rate filing.
Yeah. So how I see this going and how we've done it in the past is at the conclusion of this meeting, we'll say, provide any further feedback by a week from today by close of business. So that would be March 5th. Once I get feedback from everyone, I can take that to Andrew, TK, Tasha, our leadership team, let them know kind of what the RAC was thinking, where they were leaning. And then we'll kind of go from there. They'll typically we'll just, ideally there's a situation where the RAC kind of reaches a consensus. And then we'll move forward with that feedback to leadership. Leadership will kind of tell me what direction they want to go based on that feedback. I'll share that with the group. And if no one has any real concerns, that'll be the exhibit that we'll move forward with. We'll still have to do all of the administrative stuff of adopting a rule, but for the purposes of filing rates and plans, you'll have an idea of what the exhibit should look like.
Great, thank you.
Yep. So any other feedback before we can adjourn and give people some time back. So if anyone has any feedback, any thoughts? All right, well, seeing none, I will reiterate or just put it on the record that please get feedback to me no later than close of business on March 5th. Even if that feedback is, we don't really have a preference or it's difficult to say. Any feedback is welcome and encouraged. It helps us move forward. But yeah, otherwise, I'll wait to hear back from members of the RAC, and then I'll be in touch. Does that sound good?
Yeah.
Sounds good. Thank you.
Fantastic. Well, thank you, everyone, and hopefully we can all enjoy some sunshine today.
Thank you.
All right.
Thank you.
Thank you.
Thank you.
Thanks, Ethan.
Bye.
Bye.
Bye.